So appreciate everyone being here today. I think everyone was hoping that these COVID updates were gone forever, including myself, but hoping that the pandemic was actually coming to an end. I think now as and we'll hear more of the statistics later on, I think we certainly know it's nowhere near the end. So as this holiday weekend kicks off, we want to take this opportunity to encourage everyone to enjoy this holiday weekend, but do it in such a way that is safe for them and their loved ones. We know you obviously will be gathering with your family. We are simply asking that you make really smart decisions when you are gathering with your family. So number one, if you're feeling sick, if you are feeling sick, stay home. Number two, get a test and ensure you aren't spreading COVID to some of your most loved ones. If you are vaccinated but haven't got the booster yet, get it this week. It's a great time to schedule that booster. I personally have scheduled mine. We want everyone to make sure that they are celebrating again as safely as possible. Also, Stroll on State is Saturday. I'm glad that it's a vast majority of it is outdoors and therefore a much safer event. Researchers have said that infections can happen outdoors, but the chances are massively reduced. Fresh air helps disperse and dilutes the virus. It also helps to evaporate the liquid droplets, which it is carried in. In addition, the Stroll on State team, who has been working tirelessly for about the last 8 months, have taken a number of precautions to make sure that this event is as safe as possible. So you're going to see a larger footprint, multiple tree lighting ceremonies, so everyone isn't just grouped into one area, a new time and location for fireworks, Santa pop-up visits as opposed to just one location, indoor and outdoor letters to Santa, and mailbox locations, and everything indoors will be requiring a face mask or face covering for all of the indoor locations, and additional space is also going to be provided for all the vendors, and a number of other enhancements. So if you feel comfortable, we certainly encourage you to come down and celebrate. But today we are really talking to you because cases are dramatically surging in our area. Our healthcare workers are tired. Our hospitals are getting overrun. And as we come on to Thanksgiving, Thanksgiving was my father's favorite holiday. And he routinely mentioned to us kids that attitude and gratitude are the two things that we can control. And that's how we should really hold on to those and live our life through those. So what I would say to people watching today, utilize attitude. We control that attitude, and for a long period of time, we have felt this malaise of COVID-19, but we alone can control how we move through and live with COVID. We can do all that is within our power, and that is wearing a mask, that's practicing social distancing, that's washing your hands, that's making sure you do get the vaccine if you're healthy enough to do so. That's making sure those of us like myself who are vaccinated get the booster shot, and that's making sure that you get tested when the healthcare professionals deem that the tests are necessary. We all play a role in that. And that's, my dad also said gratitude, and I would say I am incredibly grateful for people like Dr. Martell, people like Dr. Bartlett, and even more than them, those folks who are on the very front lines of all of our healthcare systems, those folks who are in the Walgreens stores helping us, everyone who's part of this healthcare system that is keeping and working so tirelessly to keep us healthy. Let's show them respect this Thanksgiving and show them how grateful we are by doing everything in our power to stay safe, everything in our power not to spread the vaccine. We want to spread the vaccine. We don't want to spread the virus. With that, I also have the honor of reading a statement from my good friend, Chairman Joe Chiarelli. And so the following is a statement from Chairman Joe Chiarelli, who I can tell you would absolutely love to be here with all of us today. After receiving a positive COVID-19 test on November 3rd, Winnebago County Chairman Joseph Chiarelli has been out of the office and under quarantine at his home. Only mild symptoms presented at first, but a week later, the chairman was taken to the hospital and admitted to the UW Health COVID unit. There, he was diagnosed with COVID pneumonia, was put on oxygen, and received several medication treatments to improve his condition. 3 days after being admitted, the chairman was released from the hospital and has been recovering back at his home. Health experts consider this a breakthrough case, as the chairman was fully vaccinated. He is no longer COVID positive or symptomatic, but he is operating on a reduced schedule while he regains his full strength. Chairman Chiarelli thanks the community for their thoughts and concerns during this time and encourages the public to be vigilant and stay safe during this holiday season. I can tell you in my conversations with the chairman, I'd first say, as I did to him, we have a number of things in common. Probably the most apparent to everyone who meets us is we both married up. We have wonderful wives, and he has one of the best in Connie Chiarelli, and I hope everyone has their prayers and thoughts for the entire Chiarelli family. To take his words to, there's a reason that he felt comfortable and compelled to provide a statement today. The magnitude, in such a personal statement, the magnitude of what's taking place today in our community is not acceptable, and we all can play a role in that. So please, take his words to heart. Be vigilant. Being vigilant is wearing a mask and practicing social distancing. Being vigilant is making sure that if you're able, that you get the vaccine. So certainly our thoughts and prayers are with the chairman. Next up, I have the opportunity to turn you over to Dr. Bartlett. And Dr. Bartlett is the Chief Medical Officer and Vice President of OSF Healthcare, St. Anthony Medical Center.
Thank you, Mr. Mayor, and thank you for that clarity. The story you told about the chairman is spot on, and a tremendous education about what the vaccine really means to the citizens of Winnebago County. It could have been very different had he not had the vaccine. We know that people who are being admitted to the hospital with a COVID infection are 10 to 1 people without the vaccine to that one who has had the vaccine. And those who have had the vaccine generally, as a rule, have a much milder course in their illness, just like the chairman had, where he recovered fairly quickly and is now regaining his strength at home. So it's a great story, and it's great that the chairman was able to speak out on that, because that really is the experience of what we're seeing in the hospitals now. We are having a COVID surge, and its timing is very similar to the surge we had exactly 1 year ago this time. It's not quite as severe as the one a year ago, but it has a major difference. And the difference is we're seeing younger people getting sick with COVID than we did a year ago when we had the same type of meeting, and we were talking about people who are in their 60s, 70s, 80s. Now we're talking about people who are between 30 and 50 who are getting the serious, severe COVID infection. And in the city right now, there are 2 infants who are severely ill with COVID. So we can't emphasize enough that we are in the midst of another surge. All the hospitals are operating very well. There continues to be capacity to take care of our patients, take care of patients with all the medical needs that we have. But as the mayor said, it's beginning to have an impact and stress on the healthcare workers and the nurses. We have, as some of you know, needed to recruit new staff because the nursing and doctor ranks were decimated by COVID. They're tired, and the public can do its part by getting the vaccine. The vaccine works. And I know the vaccine has become an enormously controversial topic. And one of the beauties of the United States is that we will defend to the death your right to express your opinion. We'll even defend to the death your right to be wrong. And to not get the vaccine is wrong. We need to be getting the vaccine and really make it so people are less likely to spread the infection, and when you do get a breakthrough infection, it's short and you're not likely to create an impact on others, the hospital system. This is something we can win, but it really depends on the public to do is what the mayor said. When you get together with your family, be smart. If you're ill, opt out of that Thanksgiving celebration. Stay away from the rest of the family. Get the booster shot. I think as the mayor said, the booster shot is widely available now. If you haven't had the vaccine, get it. If you've had the vaccine and 6 months have gone by, get the booster shot. I got the booster shot the day it was available. It takes 5 minutes to get it. Just take your vaccine card with you and go to a pharmacy in the city, and with almost no wait, you can get the booster shot. Who's eligible for the booster? Anybody over age 18. We know that anybody with an illness or a medical issue over age 18 should get it. Anybody over age 18 who's otherwise well may get it. But we do recommend getting the booster shot. And if you've not had the initial vaccine, we again urge you to do that. The next thing I would say to you is flu has hit Rockford. It's now in Winnebago County. So everyone should be also getting their flu shot, because it's very difficult to distinguish flu from COVID infection, and they can coexist. You can get both at the same time. So we urge people to get the flu vaccine. Finally, if you believe you have the COVID infection or may have the COVID infection, the mayor is absolutely right. Get tested, determine whether you have it. It allows you to chart the course of the disease even if you're being treated at home. And should you get worse, you know what you're dealing with and you can get care right away. So we do urge you to see a healthcare provider, your physician, a hospital, a prompt care. If you are sick, get tested, and that will really help us manage this pandemic in Rockford. The last thing I would say is we're really proud of the great job the health department has done in Winnebago County in coordinating all 3 hospitals and really giving an extraordinarily strong response in this county. So, Mr. Mayor, I'll turn it back over to you.
Thank you. Thank you, Doctor, and pretty alarming information, right? What we heard is we have 2 infants who are struggling right now with COVID. We still have folks in their 70s and 80s, but also it's running rampant in folks between their 30s and 50s. So that's pretty much everyone here in our community needs to be vigilant when it comes to fighting back against COVID. Also, we heard pretty loud and clear that it's 10-to-1 those who are getting COVID. 10 being those who are unvaccinated and 1 those who are vaccinated. So please, I know most of you don't listen to me, so please listen to someone who actually has a medical degree. So again, please be cautious and vigilant. Next up, we are really fortunate, just as Dr. Bartlett mentioned, our health department has done an incredible job during really difficult times, and that's under the leadership of Dr. Martell. Dr. Martell?
Thank you, Mario. Thank you, Dr. Bartlett. And thank you, all of you, for coming and helping us bring attention to this. You know, when I think about what was different a year ago, we didn't have the therapeutics we had, and we didn't have vaccine. And so it's kind of a very challenging time when we realize we do have those now. So as I start to talk about some of these cases, we've been talking about Winnebago County being categorized a high risk of transmission now for almost 2 months. It's kind of like we're blowing through every stoplight. Our transmission rate is 502 cases per 100,000. Our positivity rate is over 10%. Currently, we have 126 individuals hospitalized. We had a kind of a 3-day total reporting 539 cases from Saturday, Sunday, and Monday. And we have a low vaccination rate of 61.4%. You've heard from our physician. With the increase in hospitalizations, our emergency departments are full, and hospitals are once again having to modify visitor policies and asking individuals to use their primary health care and urgent care. It's saddening to hear that we have 2 infants. And while we are all high in that sense, in terms of high transmission, and so maybe people have just stopped looking at the stop signs, maybe they've just totally ignored it. And I hear, well, how are we in relation to other counties? So I'm going to give you a little perspective. And I normally don't do a lot of comparison because I'm responsible for Winnebago County, but I'm going to give you some comparison statistics because I often hear, it's because we have the city of Rockford. I'd like to say that, was an easy solution, but it's not. Look at Cook County. They have 5.1 million in population, which is 18 times more our population. They have 171 cases per 100,000. Compare that to our 502. Their positivity rate is 2.5%. Ours is 10.1%. They have 441 hospitalizations. We have 126. Their percent of population vaccinated is 74.2%. DuPage County, we'll go with Naperville being a large city. They have almost 1 million in terms of population estimate, about 3 times our population. Their case rate, 212 per 100,000. Their positivity rate is 3.7%. They have 84 hospitalizations. Their vaccination rate is 80.4%. Now we'll go over to Kane County with its city of Elgin. They have about 500,000 population. It's about 2 times our population. Their case rate is 216 per 100,000. Their positivity rate is 4.9%. They have 56 hospitalizations being reported for the same time frames. And their population is 71% vaccinated. So what's the difference when you look at all of that? We all have great health care and hospital systems. We all have access to vaccines. We all have the same contact tracing programs. We have the same capacity to test. What's the difference? The percent vaccinated. And while breakthrough infections do occur based on our contact tracing data, the majority of hospitalized cases, as Dr. Bartlett alluded to, have been unvaccinated. Currently, when we look at our data, and we really looked at data going back from December of last year through the time frame when vaccinations started, only 13% of individuals who've been hospitalized have been fully vaccinated. So the majority have been unvaccinated. And we have to be clear about that. Breakthrough infections is not a reason to not vaccinate. And we understand that immunity is waning. We had the approval of the booster doses for everyone 18 years of age and older. If you've been 6 months since you got your second dose of either Pfizer or Moderna, it's time to get it. If it's been 2 months since you got a Janssen or Johnson & Johnson, get your booster shot. So what are the other contributing factors? Well, today's a perfect example, sunny and cold. We've moved indoors. But I also have to acknowledge that there's been a poor adherence to indoor masking. At the beginning of the pandemic, I got calls from the public about businesses. Now I've got businesses calling about the public. They're having a hard time. They have signs up. We have a mandate in the state of Illinois. Indoor masking is necessary given our high transmission rate. Isolating when sick. I think it's disheartening to find out people have gone into their workplaces or school knowing that they were not feeling well, knowing that they were ill, and then exposing others. We've had a hard time getting people to understand that you need to quarantine after an exposure. That means no shopping, no sports, no going to the movies. It means staying at home and staying contained so that you cannot potentially transmit the disease. So we need to make sure that people understand that the same things need to apply that did last year. Gathering of unvaccinated individuals. This is not the time to be hosting banquets and parties and things where you have a table full of unvaccinated individuals who take off their face coverings and eat and talk. That's one of the highest risk activities we've talked about before. And I want to keep reiterating, vaccinations continue to be highly effective in preventing transmission, hospitalizations, death. And we have more than 12 months now of data on safety and efficacy. So that excuse is out the door. Vaccinations are safe, effective, and available. And by available, I mean free. So I've also heard some of the excuse, well, we're just going to be endemic. We're going to live through this. It's not going to be a big deal. Well, while we understand we may not be likely to eliminate COVID-19, I think we need to understand that the goal is to reduce the impact of COVID-19 on our daily life by controlling it. As the mayor referred to it, it's attitude. It's not endemic yet. It is still controlling our lives. It's still controlling our businesses, our schools. And so we need to get control. We need to mask up, we need to wash up, we need to back up, and we need to vax up. Vaccines continue to be our best strategy ending this pandemic. So as we go into the holidays, again, we want to talk about being as safe as we can possibly be. And the risk, again, is associated with individuals coming from outside your household and removing masks to eat and drink. But there are safer ways to celebrate. Remember, we have to protect those not yet eligible for vaccination, so our children under the age of 5, so our new infants, our babies, our toddlers, because we have to vaccinate around them. So eligible adults should continue to vaccinate. Masking indoors when individuals are outside of your household. I know that seems like an odd hostess kind of activity, but we have to be serious about this. At over 500 per 100,000, the safest, nicest hostess gift you can give someone is to not potentially bring an infection into their homes. Seat households together. I always laugh in the day when I was young, we had the kid table. Some of us were out in the garage, some of us may have been in the basement.
Still at the kid table.
Yeah, so where can you seat individuals together safely? Households. Outdoors is always safer than indoors, so even opening your windows and your porch doors and things like that to increase ventilation. And please, please, if you are sick, do not host or attend gatherings. I know that everyone has been so excited. They can't wait to see everyone, but now is not the time. Remember to review the guidelines for travel. We have said before, the safest way to get someplace is in your own personal vehicle, but we understand that Wednesday looks like one of the highest travel days since pre-pandemic levels, so follow the CDC guidelines for travel. And as the mayor indicated, consider testing before gathering. Now, again, when you talk about testing, you want to do it as close as you can to the date of the event. The challenge is, if you've got antigen testing, that might be Wednesday. If you're talking about PCR testing, you're going to have to take a look and see what days and times things are open. But if you're an unvaccinated individual, consider testing before you go to your holiday gathering. But we do want you to enjoy the traditional celebrations of our season here. It's a beautiful time in our region. We have the festival lights at Sinisippi. It's completely safe. You're in your car, you're in your own area, it's outdoors, you can open up your windows. And Stroll on State. We've worked very hard with that committee to review the guidance and make sure that we are looking at all the ways that we can make this a safe and fun event as possible. So in closing, it's time to double down. It's time to double down our collective efforts to move this pandemic to an endemic status, to protect our business community, our educational systems, our families, and ourselves. Mask up, wash up, back up, vax up. Thank you, and I want to wish all of our community a healthy and happy Thanksgiving holiday. And with that, we'll be happy to take questions.